Things that have stopped me back in my life are probably the neighborhood that I'm from. Being from the Fillmore, it's a challenge because the first thing on your mind isn't like becoming a doctor or anything. It's really just about survival. Like, how are you going to be a provider for your family?
So growing up, I always seen my mom working in hospitals. From being a CNA to a registered nurse, and watching her passion just for what she did every day, it really inspired me to pursue something similar, if not the same thing.
Growing up, I've always seen my parents struggle with understanding what medicines and what they need to live a healthier life, and that really sparked my interest to help my community and help the people in my background.
I've always enjoyed helping people, and I've seen the health field as sort of like a way of life to help people, because you're dedicated to helping people pretty much.
For many years in the past, I would see students always asking the question of, well, when am I really using this? When am I going to use this? Why is this important? Why is this relevant? And I actually went to go see some Faces for the Future students doing presentations out at Life Academy in Oakland. And I saw how inspired they were, how motivated they had been by their experiences in the Faces program. And I thought, if we can bring something like that to John Connell, where the students are out in the real world having work-based learning experiences that are also supporting and connected to their work in the classroom, then it's a win-win for everyone.
We did actually, to be honest, have a lot of doubts about participating in the FACES program this year. As a new call center, we had very limited time. I think one of the concerns that we had was, how long is it going to take? These two FACES interns were incredibly passionate about their future. They are willing to learn, and they're willing to let us mentor them. And we knew that first day that we wanted to go ahead and participate in the FACES program.
It's really a relationship that is interdependent. You know, the students benefit, but we also benefit from having the students. They ask questions that we might have forgotten, that our curious mind might have been closed at a certain age or at a certain point in our career, and they reignite that.
I'm interested in helping young people and helping them discover what their calling is, what they're passionate about in life. And I think it's so important as professionals to reach out and help the next generation to discover, what they were meant to do.
We live in a really multicultural community in San Francisco. We have patients coming from various different ethnic backgrounds. And time again, our patients have told us that they would like to get assistance from people who can speak their own language, who can understand their culture.
It's very important to diversify the healthcare workforce because we are a multicultural community. And I believe the workforce has to reflect the community. We can serve our community better when we have various perspectives.
Here I am, an African American girl from a not so okay place, and then you see two other African American women who are able to do the jobs that you want to do. And so you're able to say that you're not alone and that there's others out there like you, and that you can one day be just where they're at.
Our biggest resources is the youth that we have in the community. And what better way to make sure that the community in the future is more of a community that has wellness high in its priority is to make sure that we as health professionals take the time to mentor and precept students.
I think FACES is a good program because it shows the way, to a lot of students, it shows them a lot of opportunities that weren't there before, and it also gives them connections, and it lets them get some real world experience and not just sit in the classroom all day doing schoolwork.
They really see themselves as professionals. I see some of their posts on social media where they say, I'm a future doctor, and they've got their blue coat on, or they're taking a picture outside of the hospital or the clinic where they're working, and they really are taking this on as part of their identity.
Being in FACES, I've become a lot more social, and this is definitely going to be important in the medical field because you're going to need to approach your patients openly and just address everyone in a different manner.
be compassionate towards others, because that's how you truly understand what someone is going through. And at first, I don't think that I really was able to connect with people's emotions. I was very detached to my own emotions. So with going in FACES and being in the mental health field, you were able to actually feel for what someone is going through.
Being in the FACES program has helped me discover what it is to be in the medical field, and that there's just not nurses and doctors. There's a lot more broader terms to it, and there's a lot of different things that I can go into.